No, Cole Swindell. I'm sorry. I almost lost it there. Good morning, everyone. Welcome to today's edition of AM Minnesota. Susan Prieve is with us. She's from Rice County Public Health. She's a family child health supervisor. I did not realize this, folks, and I apologize for not realizing it, that it is Infant Safe Sleep Week here in Minnesota. It has been, well, it's been all this week. Right, Susan?
That's correct. Declared by our governor, Governor Dayton, this week, November 1st through the 7th.
We're going to learn a little bit about, and there's been some changes over the years. We were just talking about that with some fathers or grandfathers.
Absolutely. We had a good conversation about a lot of the changes that we're seeing generationally about how we place our babies to sleep. So I welcome the opportunity to share the information to your listening public, and especially those parents and grandparents out there.
Yeah. Well, before we get to specifics, I want to get a little of your background. Susan, how long have you been with Rice County Public Health Nursing?
Oh, golly. I've been there 27 years.
Wow. That's about as long as I've been here.
Long time serving Rice County. And I've been in the family health unit for all of those years, been supervising that unit for about two and a half years.
How many people are in the unit?
I supervise 6 individuals.
Of course, you cover the entire county.
We do. We cover all of Rice County. We offer prenatal visits. We do family home visiting. We do newborn well baby visits, and have offered a safe sleep program as well as part of a grant we received with the Medica Foundation.
Are there any fees attached to this?
Absolutely not. Anyone who needs a safe sleep environment for their children or unable to provide that, perhaps due to economic reasons, are able to be served through our Safe Sleep Grant. And what that includes is a safe sleep environment, a pack and play, which is a neat and clean, safe environment without any additional padding, no bumper pads. It's just a nice, safe sleep place for the baby. And also something called a wearable blanket, because we also don't want babies to be covered with heavy blankets or even a blanket period in their sleep environment.
No blanket at all?
No blanket. It seems stark. I know, it does. It seems quite stark, but actually that is a risk to the baby. Those can be end up as the baby scrunches down in the crib, that can get over their face, and then we don't have proper air circulation.
Right, because they have such little lungs.
They do, and they can easily get lodged in unsafe places and can't right themselves out of that position.
Yeah, I was just thinking, I find myself many times waking up under the covers.
Exactly.
I mean, my head under the covers. So I must have been cold or something in the night.
Absolutely, and you can get yourself righted and back in a comfortable position, but these little ones might not be able to do so, so we have to do that for them.
Right. So maybe the message needs to get out to the grandparents more so than the parents here.
Both. You know, I think we as parents hear messages from our teachers, which were our parents, and even in my generation, we put our babies to sleep on their tummies. And we had a lot of strong feelings about that,
Sure.
Strong messaging. So this is a shift. It's been going on for a very long time, and now we're into the next generation of parents that are going to be doing this. So we want babies on their back in a sleep environment that has no extra padding, no stuffed animals, as cute as they are. We don't want that. No bumper pads. Still, I see in magazines from some retailers pictures of cribs with elaborate bumper pads, and it makes me sad to see that our retailers haven't been able to get past that. Many have. I saw a major retailer ad this weekend, and I'm always looking to see how they picture their cribs, and it was absolutely stark and clean, just the way we want excuse me, just the way we want to see them. But there are still images in the media that are going to show bumper pads, and that is not what we want to see.
All right, we're going to talk more about that, and more specifically about Infant Safe Sleep Week, which is going on right now in Minnesota. Nursing service, she's the Family Child Health Supervisor. Visited with us in the first segment, telling us there's 6 people in that unit. The governor proclaimed this Infant Safe Sleep Week in Minnesota. Do you know, by chance, Susan, how long this has been? Is this the first year for Infant Safe Sleep Week?
I don't know the answer to that. That's a very good question. I know it is a topic that we are increasingly want to be very active in getting this information out into the community. We continue to gather data and realize that all these efforts are making an impact, that we have been able to decrease the incidence of infant death, and we're learning more about this all the time.
I have to ask you, and you probably just explained it, but why the sudden, I shouldn't say sudden, but why the change from tummies to back?
It's a great question. We realized that when they were studying infant deaths, that many of those occurred in unsafe sleep positions. Babes were in either a co-sleeping situation where they were in bed with another individual. They were either on a, or could be in a situation of being in a couch, days of the water, remember the day of the waterbed?
Oh, sure.
So a situation like that. And more work was done to lay babies on their back. There was a hypothesis that it could be that they were rebreathing their expired air, their carbon dioxide, and that could be a contributing factor. Many of the sudden unexplained infant deaths are not actually SIDS, they are deaths due to suffocation or strangulation. And we know that that can happen by having, like I said, bumper pads in the bed or lofty bedding where they're sleeping on a thick, plush, lovely comforter. We don't want that. We just want a mattress and a sheet and a safety-approved crib.
And no blanket.
And absolutely no blanket. There are wearable blankets that are like a one little zippy with opening for their arms so that they can get their hands up to their face and comfort themselves that way. Those are recommended, and those are also something we utilize with our Medica Foundation grant.
Now you said a approved crib, so is there some sort of a seal of approval on cribs?
Yes, when you should avoid buying cribs that have been from years past. Many of the regulations have changed, so that will be a safety-approved crib. Gone are the days of the drop-side crib, and
right.
Those are what I was familiar with. Many of our listening viewers are going to be used to that too, but there have been changes in safety regulations for cribs, so be aware of that. Buying those at garage sales also are something you need to be aware of, because many of those are going to be from a time with different safety regulations.
Well, it sounds like, if I'm hearing you right, you don't want to even think about doing that. You want to get
Correct.
a approved crib,
yep.
Period.
That is one of those items you want to go ahead and start fresh. Make sure it is safety approved.
Well, when you think about it, babies falling asleep in their strollers or on their backs.
They are, but we don't recommend that be the environment you use in your home for, even for naps. We'd really prefer that you use your crib, pack and play, if that's also a safe environment, to put them down for naps. I think sometimes there's a false sense that, oh, I'm going to be looking at them all the time, so it's okay. They can sleep on my chest, or they can sleep in the recliner, or their car seat. And what we see in those situations is they're at risk. You're not, perhaps you're going to run out and get the cup of coffee, or you're going to run out and answer the phone, and your baby's left in that position, and unfortunately, that's when accidents happen and unintentional deaths can happen. When you're in a car seat, they tend to be kind of humped over, you know, and they're not getting the proper airway opening that we need. So it's really important to be aware of that.
Well, I'll be darned. See, I learned something new.
Yeah, I know it's a changing field. I know that many might be thinking, oh, I'm worried that if they are always on their back, they're not going to calm themselves, they're going to wake up all the time, and every time I lay them down, they're going to wake up. And we really encourage parents to let children learn how to self-calm, get their hands up to their face. Use of a pacifier after breastfeeding has been established is recommended. And I was surprised, and that's a relatively new recommendation. So a dry pacifier, for reasons we don't quite understand, has been shown through the research to be a preventive for a sudden infant death. So that's something to be aware of.
Now, the proclamation states that 50 children in Minnesota lose their lives every year from sudden infant death. Do we know what the number is here in Rice County?
I don't know a specific number here in Rice County. That is something I could try and research
Sure.
for you. I have not been aware of an account at this time that's been confirmed or documented
Sure.
that way.
You know about Infants Remembered in Silence, obviously.
Certainly.
Diana Sunwall, she's been on our show many times over the
Yeah.
years, talking
Great
about this.
advocate for child safety in our community, absolutely.
It's a terrific organization, and of course they had their special event up at the bridge, 35W bridge here
Absolutely.
recently.
Absolutely. Remembering all those lives lost and the work that they do around prevention and comfort as well.
And I've had some friends I know who have lost babies through SIDS, and it's really tough. I mean, you know, it is so hard. Well, anytime you lose a child, you're not supposed to, that's not the cycle of life.
It is, and if there's anything at all that we can do through public education and support to the families that have gone through this, we want to do that. Certainly in the instances that we encounter children that have passed away, we do link them up to all appropriate grief services that we can, including our Infant Remembered in Silence program.
But correct me if I'm wrong, a baby can roll over.
Babies can roll over, and the time frame that we're looking at early infancy and when you bring your baby home from the hospital is typically prior to the time that they're developmentally able to roll on their own. And parents often ask that, what do I do if my baby rolls over? And we suggest that you just simply roll them back on their back, and there will come a time when they're going to be actively rolling.
Yeah.
And at that time, they've developmentally moved past the time you're going to be able to intervene on that. But we want to protect them during those times that they can't do that.
And I'm going to guess, I didn't mean to interrupt you there,
no
Susan,
problem.
but I'm going to guess that varies with each baby too.
It
right?
does. It does. But we know that we can do prevention by not taking them into bed with us, having them on their back, keeping their crib clean and free of extra stuffed animals, toys, bumper pads. That's the message that we want to get across to people. It is a protective factor to have the baby in the room where you sleep. So that is a good idea. But have them in their own crib, in a pack and play, not in your bed. And nap time is something that we really need to remember too. That is where they're learning how to calm themselves to go down to sleep. So rather than holding them on your chest or putting them with you on the couch for a nap, let them practice during the day. Let them have a chance to have their nap in their sleep environment.
Yeah, well, one of my favorite pictures of myself as a baby is I'm laying on my dad's chest in his big recliner, and he's taking a nap along with me. But that wasn't the smart thing to do, you're saying.
You're right. That is not what I'm going to be putting out on my information too.
That was in the late 50s, you know. So.
And I think that's why I'm so glad you had me. I think some of your readers, or listeners, excuse me, may be grandparents themselves, and we learned things and did things a different way. And when we see our children practicing different practices and all the teaching that's different, we need to realize that there's research now to support that. We've also been seeing through the research that there's some disparities in who is affected by this. We know that more people of African American heritage lose children to sudden unexplained infant death, perhaps because of the ability to provide a safe sleep environment. Also more in the American Indian population, I think 4 times higher incident.
And that would be the same issue, you think? They just can't provide that safe sleep environment?
Yep, and cultural practices, we have to look at that as well. So education across the board, all generations, grandparents, parents, so that you can, grandparents can support their children's efforts to abide by the newly prescribed safe sleep practices.
Sure. Susan Prieve again is my guest. She's from Rice County Public Health Nursing Service, and again, if people have any questions, they can contact your office.
Absolutely. We welcome your calls. One other topic that people might have questions about is people worry about babes being on their back and maybe developing a little bit of a flattened head. Sometimes little ones on their back can have a little bit of a posterior flattening in their skull. And what we want to message is tummy time, because we want them to have time on their tummy to strengthen their back muscles and their neck muscles and develop that skill to eventually roll.
Just not when you're sleeping.
Just not when they're sleeping. Perfect. And having a blanket that's very, very flat on a floor when you're right there with them for playtime is highly recommended. We would like to see people doing that with their babies shortly after they bring them home, and doing that every single day, and that is the way to avoid a flattened head. That, as well as holding your baby when you feed them, rather than propping a bottle, which is not recommended. If you hold your baby when you feed them, the way you position your baby is going to also help with helping them have that beautifully shaped head that we want our little ones to have. So.
Sure. Huh.
Another interesting finding.
I'm learning all kinds of stuff here this morning on AM Minnesota. In 2015, Rice County Public Health partnered with the Medical Foundation. You guys received a small grant to purchase safe sleep supplies for families who lack the financial resources. So they fill out a form, I would guess, to see if they can't get that? Or
no, it's even easier than that.
Okay.
They just give me a call, and we will come out and actually do a safety check, a home safety check, and a nurse visit. And there will not be a charge for that. Some medical assistance plans reimburse that, but not all. And the Medica Foundation wrote a grant to help us to then be able to supply families with a safe sleep environment, and that would be a pack and play. We would give instruction on how to safely set that up and use that, and again, instructions about no toys in there, no extra blankets, just simply the nice mattress pad that it's provided with, and a clean set of sheets. And then we also message about the wearable blanket, which is a great idea for those of us that in Minnesota want our babies to be bundled and comfortable, and that is a very safe way to do that, and we are able to provide one of those as well.
For lack of a better term, how about the little whirly toys that hang? You know what I'm talking about?
Yeah, the cribmobile is, I think, what you might be referencing, and I haven't read a specific recommendation about that. I tend to like a clean and completely stripped down sleep environment so that there aren't any strings, nothing that can get entrapped around the baby. I like the crib to be positioned away from a window. We don't want the window cords that hang down where you might be pulling up and down window blinds to be anywhere near a baby's crib.
So that should be in, am I hearing that the crib should be in the middle of the room?
Can be on a wall away from a window.
Okay, as long as it's away from a window.
Absolutely. I don't want them anywhere near the cords that can be hanging on a window, and actually we like those not to be used. So.
No, I'm sure that once they start seeing those cords, they get very curious.
Very, very curious.
You know, it's amazing. Isn't it just incredible how fast children develop?
It is, and it's an ongoing and changing effort to always keep a safe home environment.
I mean, we don't realize it, but it's literally minute by minute.
Exactly,
right?
Exactly, and it's accidents that happen unintentionally. That's the acronym that SUID is, sudden unexplained infant death. SIDS is just one part of that. The others are able to be traced to preventable causes such as strangulation, suffocation. Those are things that we could have prevented with safe sleep environments and following the recommendations that are set forth.
Well, even a couple of families I know that have gone through the SIDS, they felt guilty about it happening, and tried to explain it. There's some things you can't explain.
There are unexplainable losses, and that is a subset of sudden unintentional infant death. That is a subset called SIDS, and all infant losses are a loss to our society, incredible tragedy to the families that have to endure that. We are grateful that there are resources in our community, such as IRIS, to be able to support those families. And we want to, in any way, do any prevention efforts we can at Public Health. So I welcome your phone calls, and would be glad to come out and bring out information if any other organizations would like to hear more about this, or if anyone would like to have an individual home visit, we'd be glad to do that.
Yeah. Now, you may already be doing this, but do you provide this service at birthing classes or anything so that parents can get this information at their class?
Yes, we have support groups that we're offering in all communities in Rice County. We have a group going on in Lonsdale, Northfield, Faribault, called Baby Stop in Faribault, Baby Talk in Northfield, and Baby Talk out in Lonsdale. We also provide those classes in a Spanish-speaking format and Somali-speaking format, as well as another group that is for young parents. So through those groups, we do active messaging about safe sleep. Our hospital partners, Alina District 1, Northfield City Hospital, the New Prague Hospital, Owatonna Hospital, all refer to Public Health for well baby visits, regardless of socioeconomic status. It doesn't matter how much money you make, you can have a Public Health nurse visit. And certainly we bring more messaging out on an individual basis at those baby visits.
Susan, I'm going to ask you something you're probably going to say, Gordy, why did you ask me that? But do you think this should be required, these visits? When a baby first comes home, they should have a visit to make sure that they are in a safe sleep environment? I'm just asking.
Required, I hesitate to say that, but what I would love to say is recommended, and I guess I'd love to get the message out that Public Health is for everyone, regardless of your economic status, regardless of the number of babies that you've had. Public Health has messaging for everyone.
Because when I hear this, I think maybe it should be required. Now, this is just my own personal opinion, because these little ones need an advocate, and that could be Public Health nursing to make sure that they are in safe sleeping environments.
I think the approach of offering support and making available any kind of barriers to being able to provide that is the route that Public Health has traditionally followed. We're always looking at barriers to accessing medical care, barriers to being able to appropriately provide a safe environment. We have a Healthy Homes grant that we've talked about in the past, about always looking at preventive safety, whether it be for our elderly in their home or for parents with young children. And I think the Public Health approach of support and advocacy versus legislation around requirement has been a positive approach, a well-received approach, and is probably the method that we're going to be following.
Sure. So people, don't be afraid to call, though. I mean, isn't that the bottom line message here?
Absolutely.
You guys are more than appreciative of people giving you a call, and you can come into their home and give them an assessment of what you see.
Absolutely. Absolutely. And no worries about cost for that.
Yep. No, not a single dime. And they just come in the home, look it over, and say, you're good to go, or make some suggestions on what could be done.
Exactly. Exactly. Easy to access, no form to fill out. We bring that to you, and the services that we provide are confidential. They're handled in the same way as if you were in a physician's office.
Now, these grants, this medical foundation grant that you receive for supplies, does that include cribs?
It's a pack-and-play form of a crib. It is not your full-size crib, but it is a safety-approved sleep environment.
So if I personally wanted to donate to something like this, to provide these for people who need them, is there a way I could do that?
That's a wonderful idea. I think there are other programs in the community that may also provide programs like this. Our United Way is another way to be doing some donation into the community, although I don't know that they do this specific program. They certainly serve the population through your charitable donations.
Well, I don't even know. Give me an idea, Susan. what does the price of one of these approved cribs cost nowadays?
Oh, I think they're running about, by the time I buy 2 sets of sheets, I'm running about $75 to keep the little one safe. It's a great investment, and we really want to continue with this program. And again, our services are your tax dollars at work. We appreciate the tax support of our community. And while we are active in trying to get grant funding in order to use less tax levy, your tax dollars are at work in public health, and we appreciate that.
Again, the bottom line is get a safety-approved crib. That may not, it could happen at a garage sale, but the best advice would be to buy a new safety-approved crib.
Absolutely. Yep, that would be the messaging we're looking for.
And you want it to be clean. You don't want it to have blankets in it, toys in it, stuffed animals in it, anything like that.
Yeah, it's a new way of thinking, and it's reversing the way you've looked at things in the media, but that is what we want to see, and that's the gold standard now, is a completely clean, nothing but a mattress and a sheet, safe sleep environment, and that's the best gift you can give.
All right. That's the new message coming out today. How long has this been in the works?
Oh, we've been doing this for, golly.
I mean, from the tummies to the back.
A long time, long time. I don't know what year that was shifted, but
it's been around a while, you're saying?
I would think more than 15 years.
Oh, okay. All right. Thanks a lot, Susan.
18 years, because I think
Well, there you go.
18
You're thinking
years
of
at
your
least.
kids. Thanks, Susan. I appreciate it very much.
Thank you.
Susan Prieve with us this morning from Rice County Public Health Family Child Health Supervisor. The number to reach her is 332-5916.
Perfect.
332-5916. If you want more information, we really appreciate her stopping by. None of us wants to see. I read funeral announcements every day. When I read little ones, my heart just aches for the parents, the grandparents, for everybody involved, the siblings. It's just so sad. That concludes today's edition of AM Minnesota on KDHLAM in